If pre-medications are ordered and required by your physician, your nurse will administer these next. Your medication will have arrived to our clinic prior to your infusion and will be in our temperature-controlled fridge. Your nurse will then remove the medication from the fridge and prepare it on the counter for your infusion. Your nurse will administer the medication over the amount of time ordered by the physician. Every patient and every medication is different, so infusion times will vary. Depending on the site, your physician may be on-site or on call for support should it be needed.
Your infusion will take as long as it needs to ensure that you're getting good quality patient care, and it will really be dictated on the physician orders for how long your infusion takes. We also try very hard whenever your physician is needing you to have some blood work done or blood levels done, that we try and draw those with the same needle poke to start your IV. So we really try and reduce how many needle picks you're getting when you come to our NMR clinics. Those test results then land back with your physician whenever the lab gets those test results completed, but we really try and do it as seamless as possible to give you the best experience.
After your first infusion, we highly recommend that you stay for a 1-hour post-observation period. Some medications will have more than one recommended post-observation period. However, there is always a minimum of 1 hour. We do allow patients to decline this post-observation period through signing our waiver. However, this is not something that we would recommend from a safety perspective.
I think one of the most important things is to recognize that your physician team, your nurses, and the new coordinators that you'll be meeting to help you transition to the biosimilar understand that this is a stressful time. It's completely understandable, and the team is definitely here to work with you to answer any questions that you have and that you will have during the transition process. I think from my experience though in BC, I have to say that although initially there was a lot of concerns, rightly so, from our patients, that overall it's gone very well. And I think one of the keys to that is for patients to understand that their concerns will always be heard and that it is a normal process to feel stressed about it.
Patients sometimes fail a biologic and then have to switch to a new medication. The added benefit for these newer clinics of Innomar and Bayshore is that they will infuse all of the biologics. And now, instead of just changing the medication, you don't actually also have to change your clinic and your nurses during this difficult time of switch. Sometimes there's anxiety of patients switching to a perceived biosimilar or a new medication, but I usually reassure my patients that this is something that's been going on for years. And in fact, multiple countries in Europe, we see these patients who go through the biosimilar switch in other provinces have done exceptionally well. Although they go on to a new medication, they do well clinically, and ultimately the experience in these new clinics in the Innomar and Bayshore is the same as in the original clinics.